Hello everyone. So welcome back to another revision series for FMGE pharmacological MCQs. So myself Dr. Padmanabha TS. Let us take some more MCQs in this session in continuation with the first revision session. So let us continue with the 11th question, that is the memantine. The memantine is used for the treatment of, please remember, memantine is a NMDA receptor antagonist. Memantine is a NMDA receptor antagonist. So memantine is used in the treatment of Alzheimer's disease. Please remember, treatment of Alzheimer's disease. They are used in the treatment of mild to moderate Alzheimer's disease. So what will be the treatment which is preferred for absence seizure? It will be your sodium valproate. So the treatment of syphilis will be, the drug of choice will be benzathine penicillin. Benzathine penicillin G. And insomnia, the drug of choice will be from the benzodiazepines. So what are the other drugs that can be used in the treatment of Alzheimer's disease where there will be a alteration in the cholinergic neurotransmission? So you can use Dr. Good. D stands for donepezil. R stands for rivastigmine. G stands for galantamine. So these are the drugs which are used in the treatment of Alzheimer's disease. So next, moving on to the 12th question, that is, which of the following acts by inhibiting the release of acetylcholine from presynaptic neurons? So let us understand the presynaptic function. So here you can see it is a presynaptic nerve terminal. Here there will be a postsynaptic. So what happens means, just I will tell briefly about the major steps. The colon will be entering, and with the help of choline transferase, it forms the acetylcholine, and these acetylcholine will be taken up by the vesicles, and it will fuse to the presynaptic neurotransmitter whenever the action potential arrives, and it will be released, and this will going to act on the muscarinic as well as the nicotinic receptors, and this will be degraded with the help of acetylcholine esterase. So here that they are asking the drug which are inhibiting the release. So they are asking here, inhibiting the release, which is the drug which inhibits this site, so that acetylcholine will not be released. So it is, please remember, the answer is botulinum toxin. So this is the site. Let us mark it as site A. And here the choline intake will also be suppressed by with the help of which drug? It is hemicolinium. Hemicolinium. Here also one more drug which can block the vesicular monoaminergic uptake of acetylcholine. Here the example is vesamicol. And neostigmine, as you know, it is used in the treatment of the myasthenia gravis. So here the drug which will going to inhibit the release of acetylcholine is botulinum toxin. The answer is botulinum toxin. Next, moving on to the next question, that is the all of the following are side effects of Ritodrin. So please remember, they're asking the side effect of Ritodrin. So Ritodrin is a, so what is Ritodrin? Ritodrin is a tocolytic drugs. So it is a basically a beta agonist. So what is the common feature of beta agonist side effects? It will going to cause three T's. One is the tremor, tachycardia. It can cause T wave changes due to the hypokalemia, and also due to the beta 2 agonist on the vascular smooth muscles. It can lead to relaxation whenever beta 2 is stimulated. Beta 2 receptors in the vascular smooth muscles will going to cause vasodilatation, which further it will going to cause the fall in the blood pressure. And this edema, pulmonary edema, is more specifically seen with the Ritodrin. So what does this beta 2 agonist will do with respect to the glucose? It will inhibit what? Basically the beta 2 blockers will mask the symptoms of hypoglycemia. Whereas here the side effects you can see tachycardia due to vasodilation. You can due to hypotension, and tachycardia, hypotension, and pulmonary edema are seen except for the hypoglycemia. Here the answer will be hypoglycemia. Next, moving on to the next question, that is what does LD50 signifies? So as we discussed earlier, LD50 stands for lethal dose. LD50 stands for the lethal dose. So it is represented by a therapeutic index where we have LD50 by ED50. ED50 is the effective dose, and this 50 represents the 50%. So let us see the options. It is the dose at which 50% of the animals will die. It is the dose at which 50 animals will die. It is the dose at which 50% of the patient will get desired response, and is the drug at which that will be effective in 50% dose. So the correct answer for this question, that is LD50 signifies, is here the answer, it is the dose at which 50% of the animals will die. Whereas ED50 is it is the dose at which 50% of the patient will get a desired response. So this will be the ED50. Basically, we'll come to know the safety profile of the drug. Safety of the drug. Safety of the drug. Safety of the drug. Next, moving on to the next question, that is a patient with history of snake bite presented in emergency with symptoms of fatigue and irritability. 10 vials of anti-venom were administered intravenously, but the patient is still having difficulty in swallowing. He has got ptosis, respiratory distress, and what should be the next line of management? So as you can see, the snake bite, it causes neuromuscular block. So why you can tell that this snake has caused neuromuscular block? Because the patient has got ptosis, respiratory paralysis, respiratory distress. So the snake must have blocked the neuromuscular junction. So usually it will be the cobra bite, cobra poisoning. So what you have to do is at the neuromuscular junction site. So NM block will be there at the junction. You need to increase the acetylcholine. So how are you going to increase the acetylcholine? By giving acetylcholine esterase inhibitor or anticholinesterase. Here, which is the anticholinesterase you have in the option? It is the neostigmine. So your answers for this question will become a option A. So why you need to give atropine along with that? Please remember, so whenever you give acetylcholinesterase inhibitor, there will be increase in the acetylcholine, and these increased acetylcholine will going to act on both muscarinic as well as the nicotinic type of receptors. So here NM type of receptors, it will increase the activity, it will improve the muscle strength, whereas it will also act on the M3 receptor and it will going to produce the side effects. To block the side effect of muscarinin, you are giving atropine. So along with the neostigmine, you need to give a atropine in case of the snakebite poisoning. So neostigmine is a cholinesterase inhibitor, or it is also called as anticholinesterase, and atropine is administered to overcome the side effects which are caused by muscarinic action. So atropine is an anti-muscarinic agent. Next, moving on to the 16th question, that is, a known patient of bronchial asthma was started on treatment with anti-glaucoma drugs. During the course of treatment, the asthma worsened. Please remember, the asthma has worsened following the anti-glaucoma drugs. So which drug is likely responsible for the symptom? So as you know, the patient is having bronchial asthma. So in bronchial asthma patient, if you are giving a anti-glaucoma drug, and it is causing bronchoconstriction. So which is the anti-glaucoma drug which can cause bronchoconstriction? As you know that in case of bronchial asthma, the beta 2 blockers, what it will do? It will going to cause bronchoconstriction. Here also, which is the beta 2 blocker which can lead to bronchoconstriction? It is the timolol. Timolol will going to cause bronchoconstriction, which is a beta blocker. Brimonidine is a alpha agonist. Latanoprost is a prostaglandin F2 alpha analog, and pilocarpine is the miotic. So timolol is a beta blocker. So the here answer will be the timolol, which can precipitate the attack of bronchial asthma. So this is the right answer for this condition. So bronchial asthma individuals who are having glaucoma, if you put up on anti-glaucoma drugs, you make sure you're not going to have the beta blockers. So if you had beta blocker, it will going to cause bronchoconstriction. Next, moving on to the 17th question, which of the following is the fastest urate lowering therapy in case of tumor lysis syndrome to prevent renal damage. Let us understand what happens in case of the tumor lysis syndrome. So as you can see that in tumor lysis syndrome, there will be rapid breakdown of the cellular component. Mainly it is the purine and its metabolites will be formed, and these purine will be excreted out with the help of the hypoxanthine. It will form hypoxanthine, and with the help of xanthine oxidase it forms xanthine, and it will be excreted through in the form of uric acid. So what happens is, if you give a allopurinol is a inhibitor of the xanthine oxidase. So let us take another color. Allopurinol as well as the febuxostat. Febuxostat will block the xanthine oxidase. But anyway, by allopurinol is a drug of choice for chronic gout. But by inhibiting the xanthine oxidase, you are going to inhibit the formation of xanthine. But what happens to the uric acid which is already formed, to increase the excretion of uric acid which is already formed? So the question is fastest acting uric acid lowering therapy. Here you need to use the drug called as rasburicase. As you can see, it is a recombinant urate enzyme, that is uricase. You can see here, uricase. It is the uricase. These uricase is present only in case of birds. But in humans, you have prepared a recombinant form of the uricase, which on administration it will be converting the uric acid into allantoin, which gets easily excreted. So here the fastest urate lowering therapy in case of tumor lysis syndrome, so that you can prevent the renal damage. So purine as well as uric acid will going to cause renal damage. By increasing the excretion of the uric acid, we are going to prevent the renal damage. So here the answer will be your rasburicase. So what is furosemide? Furosemide is a high ceiling diuretics. It is the high ceiling diuretics. It is also called as loop diuretics. So next, moving on to the question number 18. That is, a patient presented with unstable angina and was presented on 325 milligram of aspirin. What is the correct mechanism of action of this drug at this dose? So this 325 dose of aspirin is a low dose aspirin. So it may range from 75 milligram to 325 milligram. At this dose, it will going to specifically inhibit the thromboxane A2 synthesis. Thereby, it will going to prevent the platelet aggregation. So it is an antiplatelet drug. It is a antiplatelet drug. So let us see the options to find out the correct answer. So act by inhibiting the aggregation of platelet. This is correct. So it act by inhibiting the COX-1 in both endothelium and platelets. So please remember in the COX-1, 2. COX-1 is basically present in the platelet and COX-2 is basically present in the endothelium, but not COX-1 cannot be present in both endothelium as well as the platelets. So it is predominantly present in the platelets, but in case of endothelium, it is COX-2 enzyme. So third option is it acts as a fibrinolytic agent. It is not a fibrinolytic agent, it is an anti-platelet agent, antiplatelet agent. It acts as an anticoagulant. No, it doesn't have got a property of preventing the coagulation. It has got property of preventing the platelet aggregation. So here the appropriate answer will be a option A, that is the aspirin will going to act by inhibiting the aggregation of the platelets. Next, moving on to the 19th question. A known hypertensive patient came to emergency department. What are the complaints of palpitation and shortness of breath? Her BP was 220 by 140 mm of mercury. And among the option given below, which drug should not be used? So please, here are the catch. Here are the catch. Should not be used. Should not be used in the treatment of this patient. So please remember, the patient has got hypertensive emergency. It's a malignant hypertension. So the patient is in case of hypertensive emergency. So you can use drugs like nicardipine, which is a calcium channel blocker. Then you can use esmolol, which is a shortest acting beta blocker. You can use nitroglycerin. You can use nitroprusside, but nitroprusside use has been decreased nowadays. But mannitol is the odd man here. So mannitol is given in case of cerebral edema. If the patient has got cerebral edema, this could have been the one of the option. Cerebral edema. So here, so you can find out this is used in hypertensive emergency. This is used in hypertensive emergency esmolol, and nicardipine is used in hypertensive emergency. So the option left out is the D, which is the answer for this question. So this cannot be used for the treatment of hypertensive emergency. So mannitol is used to reduce the cerebral edema. Next, moving on to the 20th question, that is a female washing clothes in cold water exhibited a color change in her hand from paler to red. So which of the following is the drug best suited for this patient? So please remember, if there is a color change, the patient will have cold extremities, and the patient is having Raynaud's disease or Raynaud's phenomenon. So which is the drug, this is a peripheral vascular disease. So usually in case of peripheral vascular disease, the blood vessels will be vasoconstricted, so you need to give a vasodilator. So here one of the most potent vasodilator will be the calcium channel blocker, which is preferred in the treatment of Raynaud's disease. So this was about the other very important 10 MCQs, apart from the 10 MCQs which were discussed in the previous revision session. Totally we have covered a 20 important MCQs that you can expect in your upcoming FMG exams. So again we'll come out with a new series with some more important MCQs that you could expect in the upcoming exams. Thank you.